right? So we're going to start with pain. Okay, so on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you can imagine, what's your pain right now?
0.
Okay, so I want you to express this, you guys, at the final 0 over 10. I want you to get into the mode of thinking that this is a ratio. All right, and where is my, oh shoot. Okay, have you got a newer file with the, yeah, good. Here, I'm gonna, thank you very much. I'm just gonna borrow this. All right, okay, so I've done the pain, so now you guys, I'm gonna go to skin, all right? And I'm gonna take the back of my hand, and I'm going to go all the way to the tip of the fingers. On the lower extremities, I want to go all the way to the tip of the toes. And I'll tell you why in just a minute. Okay, so, and then I want to also check, I want to palpate for edema of the lower extremities. And usually that's because you've got some kind of a break or something, just like I have edema under here, I have had. Under here because I broke a bone, all right? So this is the kind of edema you're looking for. This is not to be confused with cardiac edema, which is from fluid buildup from a heart that's weak, all right? Okay, so her skin is appropriate to ethnicity. It is warm, dry, it is smooth. I don't see any rashes, bruising, or lesions. I see 2 piercings on the right ear. I see 1 piercing on the left ear. And I see no visible tattoos. All right. And skin turgor is as expected. I'm going to be doing the little pinch up here. Skin turgor is as expected. No tenting noted. Now what I'm going to do is, all right, so I know that I already asked you your name earlier, but can you please tell me your name again?
Amanda.
Okay, and can you tell me where you're at this afternoon?
Denver School of Nursing.
And what day is today?
Friday.
All right. So, patient is awake, alert, oriented to person, place, and time. Her level of consciousness is as expected due to the fact that she can actually answer questions appropriately. Her face is symmetrical. Her speech is clear and understandable. And I'm going to now do Perla. And what I'm going to do first is I'm going to have both of her eyes, because she's got 2. I am going to use the pupil gauge, and I'm going to measure both pupils. All right? Now, can you please put your hand over the bridge of your nose? Thank you very much. And so I'm going to shine the light twice. I'd like you to kind of look here at my shoulder. And I'm going to shine the light twice. So here we go, shine. So I'm looking at the pupil that I got the light shined the first time. Second time I'm looking at the opposite pupil, because I'm trying to make sure concentric constriction or concentric light reflex, either one is appropriate, is as expected. Okay, now can you please follow my pen? All right. And I would like you to also follow my pen without moving your head, please. All right, so pupils are 3+, equal, round, reactive to light, with accommodation. Concentric constriction is present. The 6 cardinal fields of gaze are as expected. Therefore, cranial nerve 3, which innervates the inferior rectus, superior rectus, medial rectus, and inferior oblique, is intact. Cranial nerve 4, which is the superior oblique, is intact. Cranial nerve 6, which is the lateral rectus, is intact. And then also, I've already talked about facial symmetry. Can you smile for me? Can you frown? Can you puff your cheeks? Can you raise your eyebrows? All right, facial expressions are as expected. Cranial nerve 7 is intact. All right. And then can you open your mouth for me? Okay, thank you. Okay. And lips are pink. Buccal membranes and soft and hard palates are pink and moist. The uvula retracts. It is midline, retracts as expected in response to ah. And then I'm going to do the trachea here. Trachea is midline. All right, are you having any cough today?
No.
Any shortness of breath?
No.
Okay, all right, so can I have you sit up for me, please? All right, so I am inspecting her. I'm looking at chest rise. I am seeing that chest rise is symmetrical. I am seeing that breathing is non-labored or unlabored. Okay, that's really, I have to see. All right, now I'm going to auscultate sounds. And you guys, all I'm going to do in the interest of time is I'm going to show you and count out the auscultatory points. I'm not going to have her breathe, okay, so that I can get you out of here when you need to get out. Okay, so 1, 2, 3, 4, and then kind of, 5, 6, 7, 8. All right, right. Fight for the right. Anterior, 1. Posterior, 2. Anterior, 3. Posterior, 4. All right, posterior. Again, C7, straight across. 1. Oh, I'm so sorry. 2. 3. I'm starting to follow the scapula now. 4. 5. 6. 7. 8. And then 9. And 10. And 7 and 8 were a little bit too high, guys. I didn't mean to do that, but I did. So I'll tell you right now it was too high. All right, then left side. Anterior. No, posterior. Anterior. Posterior. Okay, now I'm going to percuss. All right, so percuss. 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 Percuss, and it won't be over close. Percuss. Percuss. Sarite. Questions? Okay, did that help?
Yes.
Okay. All righty then. Thank you.